So yes, this is just kind of explaining what we've already said. Statutory, it's expected, it's required, and it's permitted. Permitted. It's a formal type of service production, state funded through our tax paying. So it's delivered through the NHS. We've got our social services, education services, as well as local authorities. Okay. And then we've got private care services. They run as a business for profit. And the care services include things like hospital care. We have our private dentists, private opticians, private pharmacists. They do stuff around health prevention, promotion, and protection. So they do kind of the same thing that our Public Health England does. However, it's for the purpose of making profit. It's a business. So things like Slimming World, for instance, yeah, they're delivering a health message, which is to say, living a healthy lifestyle increases your life expectancy, increases your quality of life, all of which our NHS nurses and NHS GPs are telling us. However, they're going to charge you money in order for you to achieve that. Voluntary care, I can't talk today, sorry. Voluntary care services. Okay, these are, again, just repeating it, non-profit organisations, and some of the services they provide range from healthcare, personal counselling, social care and social justice, to health protection as well. Okay, so your criteria, or the question for this criteria is, how then can we link, what is the interrelation that happens between statutory healthcare and private and voluntary healthcare? So how does statutory link? Why does it actually link? Let's ask the question first. It's all about the money. Okay, so the founding principles, if you remember, for the NHS is that healthcare should be available to everybody irrespective of means. Okay. And then in 2012, we've been discussing that we had that massive restructure. Okay, as part of that restructure, we're starting to see more and more private and voluntary companies work hand in hand with statutory health. Okay, and why? It's about the money, it's about saving money. We're recognizing that the population is increasing, and so is the need, and so is the demand and the burden that's placed on the NHS. So if the NHS can't answer to all that burden, what they're going to do, they're going to start outsourcing, they're going to start working with private companies, they're going to start working with voluntary organisations. So the partnership between NHS organisations and private and voluntary sector is an important strategy for making breakthrough in service quality and productivity. Since the 1980s, voluntary and later private organisations. Remember what happened in the 80s? Thatcher, right? Outsourcing to ancillary services to other companies, things like catering, security. Thatcher started to outsource to other companies. Yeah, so since the 1980s, voluntary companies and later private organisations began to play a greater role in health and social care, alongside and sometimes in place of statutory. Okay, so there are times as well where voluntary and private organisations become the greater voice. They begin to take the place of statutory services. Voluntary organisations provided services often in areas where statutory service was lacking, such as drug and alcohol support and treatment. So we have a company like Action on Smoking and Health. That's a voluntary organisation, charity, that provide support for rehab and alcohol support. Now, when the NHS isn't doing enough in that, voluntary organisations start to step up and take that place. And private organisations like pharmaceutical companies make products necessary for public health measures like vaccination. And advertising agencies offer advice and health education campaigns. So whilst we have the NHS as our main healthcare delivery in the UK, we have giants within the voluntary and the private organisation that is providing similar and sometimes in the place of statutory. Okay, so why should statutory link to private and voluntary healthcare services? Obviously, it's a no-brainer. It improves public health. If one person is trying to reach 1,000 people, it would take less time for 3 people to reach 1,000 people. I hope that makes sense. It's cost effective. Yeah, so we have things like free exercise groups, free stop smoking services run by voluntary healthcare services. Accessibility. Okay, so we have in Wolverhampton, we have 2 main hospitals, I believe, no, 3. So we have the main one as New Cross, and then we have one in Penn, and we have one in West Park. So that's 3 large-ish healthcare facilities for 250,000 people. Okay. Sometimes it's not accessible. For instance, I live in Purton, and my closest healthcare service, which is at New Cross, is miles away. Okay, so but Nuffield is much closer. Not that I can afford it, but for some people it gives them that option to have something that is more accessible to them. For instance, community services run by voluntary organisations, day centres, exercise groups could be more central to where you live in comparison to something that's miles away. And private and voluntary healthcare services provide things like health education, things around debt counselling and healthy eating. Okay, so I want you to think of practical ways that statutory services could link to voluntary and or private services. I'll give you a quick example. So which one should I pick? Okay, job centres and welfare services. So as part of the welfare state that operates within the UK, people are entitled to welfare services that they can get in job centres. So that's a statutory social care that's delivered in the UK. So let's say I am unemployed and I want to find a job, and the lines at the job centres are absolutely ridiculous, and I can't find advice because there's so many people using that same service. I could go to a recruitment agency. Okay, I could work with per temps and be able to get the exact same service that I would have got at my local job centre. Does that make sense? Okay, let's try another one. Social service. Okay, let's say I'm experiencing domestic violence and I need help. Okay, I want help for myself and my 3-year-old daughter. Okay, so I could go to my local council and get social service and support in that way, housing, rehousing and protection, etc. Okay, but every time I ring the helpline, it takes forever for someone to get to me, and I've tried for weeks. I could ring Haven and spend 15 minutes waiting max and be sorted the same week. Okay, so there are some times where it makes sense to use private or voluntary services in place of statutory. Now, there are also times where statutory actually link themselves to voluntary or private. For instance, rehabilitation hospitals. Okay, let's say the stroke ward in West Park Hospital is overrun. Okay, so there aren't any beds, and there is more and more patients coming in. The NHS could decide to say, okay, let's go, let's work with a private residential home to get some, to purchase or have a contract with them that when we are full, we can actually send some of our patients to a local residential home run by a private agency. Okay. Another example could be staffing, okay? Some of you might work within care, and you've known times where you work for a private care agency and you've been contracted to actually go into the hospitals because they are understaffed. Okay, so there are times where it makes sense in order to save money, to increase productivity, and to keep with the NHS ethos of making sure that everyone receive quality-ish healthcare, irrespective of how much you have and irrespective of means. Okay, right, so I want you to pick one statutory service and see how it could link to voluntary or private service. Okay, if you've got any questions, please put it in the comment section and I will be more than happy to answer your questions. There won't be any Teams call today. Again, I know I said we were going to have it, but again, I feel like this is self-explanatory. So if you've got any questions, ask me. We're going to do our last catch-up next week, and I'm really hoping that everyone attends that, because that will be kind of the last time I might be seeing all of you in one group. Okay, take care of yourselves, miss you, and I will see you soon.